Okay, we're going through the grading procedure for a complete denture, wax trial denture setup. And as you can see on the grade sheet here, we start out with anterior tooth position because it sets up the relationship of the posterior teeth. And even though the points possible on the anterior teeth amount to only 6 points, everything at the top of the sheet tends to affect the results you're able to produce in the lower part of the sheet. So, for example, if the relationship of the teeth, of the posterior teeth to the ridge is off, or the occlusal plane is incorrect, it makes it very difficult for you to get all your points on the excursive positions. Okay, and the same is true with the anterior teeth in relation to where the posterior teeth are going to be set up. So let's take a look at the setup. It's a very nice, neat setup. One of the concerns here in doing our grading is we start out by looking at very general things first. So we want to make sure that the skeletal relationship is correct, meaning that the vertical dimension has been maintained so that the incisal pin opening is the incisal pin is still in contact with the incisal table, and that the pin setting is correct, and that's been maintained very well in this particular setup. The other thing we want to look at is kind of general symmetry in terms of the occlusal plane location, in terms of the progression of the curve of Spee and the curve of Wilson. And in general, that looks very nice as well. And as you can see, this is a nice, clean, very neat setup that was done. Now, to get down into specifics, when we look at anterior tooth positioning, we're going to be looking in a number of areas. Starting out really with the arch form, okay? Whether the arch form is narrow or wide in relation to the land of the cast. Now, one of the first things that we notice here in this particular situation, or this particular setup, is the arch form tends to be a little bit wide anteriorly. Okay? And that's going to cause some potential problems in terms of setting the posterior teeth a little too wide, getting us off of the ridge in the premolar region here. Another thing that can happen when the arch forms a little bit wide anteriorly is that we tend to start the posterior teeth more anteriorly the wider the arch goes. And the more anterior we are, the more potential there is to, again, be off the ridge in the mandibular premolar region, as well as perhaps not having enough room to set the teeth in terms of the excursive positions, okay, to avoid cusp interferences. So that's one thing. In terms of the arch form's a little bit wide here. Okay? Now, the other thing we look at is individually, again, we start from general things like arch form to smaller things like axial inclination, is we want to also make sure that there is no centric contact between the maxillary anterior and mandibular anterior teeth. And here, the relationship is a little bit tight. There's not contact, but when the horizontal overlap gets very tight like this, one of the concerns is whether or not that's going to cause an interference problem. Okay, so we want to take a look at that real closely. So I would say that the horizontal overlap is a little bit deficient, primarily on the distal of tooth number 8. But the consistency of the horizontal overlap is relatively good. If you compare the right side of the patient to the left side of the patient, you notice a little tighter on the right side. Okay? Now, the other thing in terms of axial inclinations is the positioning or the angle of these teeth here. Right here, you can see that the angle is pretty good. We've maintained the long axis angulation of about 15 degrees. The canine is perhaps a little bit too vertical, and that may affect us in our excursive position or excursive contacts of the incisal edges. So we'll take a look at that later as well. On the patient's left side, this is a little bit more of what we want in the maxilla, in terms of the 15-degree angulation. In the mandible, in order to take up the space, you notice that the angulations may be a little bit excessive here. Looking at it from the frontal plane, the amount of toe in, however, is pretty nice on both the maxilla maybe a little excessive in the mandible, but within reason. So taking off points for the arch form, maybe the horizontal overlap position, we'd probably assign this about 4 points out of the 6. Okay. Now, the important thing to remember, though, is that those 2 points may have cost us some other points further down the grade sheet. Now, in terms of the relationship of the posterior teeth to the ridge, one of the first things that we're going to look at is the most critical arch in relation to this, and that refers to the tongue space as well as the arch form of position of the tooth within the arch form, is the relationship between the mandibular posterior teeth and the residual ridge. Now, what we're going to do is we want to make sure that our reference marks are correct and they appear to be lined up nicely. We're basically connecting a point from the medial lateral center of the retromolar pad to a point approximately where the first premolar is going to end up being, and then we just connect that in this view. Just connect those 2 lines, and what you're going to see is that on the patient's left side there's going to be a tendency to slightly lingual to the ridge. Now, there's a limit as to how far lingual we can be because we don't want to impinge on tongue space, but at the same time, since the mandibular arch tends to get, the mandibular ridge crest tends to get a little wider in terms of arch form with further resorption, it's not uncommon for us to be slightly lingual to the ridge here. So the main thing is to connect the center of these teeth so that it corresponds to this line. Another thing that we can look at is we can just look sight down the ridge here in the area of the second molar to make sure that the center of the tooth, the central groove of the tooth, lines up with the highest point of the ridge crest here. Okay. You got that angle here. And the same is true, of course, for the patient's right side here. And according to that, the teeth